It gives me great pleasure to introduce our next guest speaker. This is a man that I came to know early this year as we met in his office to discuss issues of concern to veterans, issues of concern to the American Legion, and issues of concern to the agency that he is now leading. He is a 1965 graduate of West Point. He went on to complete 38 years of honorable military service in the U.S. Army, to include 2 combat tours in the Republic of Vietnam, and his career as Army's Chief of Staff from 1999 to 2003. He has shown himself to be a friend of veterans and sincerely wishes to do a cooperative work with veteran service organizations in general and the American Legion in particular. He has become a friend, and it's my honor to introduce to you the Honorable Eric K. Shinseki, Secretary of the Department of Veterans Affairs.
Good morning, everybody. Thanks for that very, very warm welcome. Jim Couch, thanks for that kind introduction and for your leadership of the American Legion. Let me also recognize Chairman Sanders. I know he spoke earlier, and Chairman Miller, who's waiting in the wings. Let me thank both chairmen publicly for their leadership and support of VA as we transform this department to better serve veterans. Senator Jim Webb is here also, I believe, and I think all of you know that he was so instrumental in putting forward legislation for the 9/11 GI Bill, which has taken care of so many of our youngsters today. My acknowledgement of him as well. Members of the Legion leadership, Peter Gaeton, Dan Wheeler, Vice Commanders Jeanette Ray, John Nealon, Glenn Hickman, James Holland, David Hall. Also, let me acknowledge Peggy Thomas for her leadership of the auxiliary, and Chris Hunziger for his of the Sons of the American Legion, and special thanks to Chairman Ken Governor for his hospitality in getting me and my team here this morning. Other members of the Legion, fellow veterans, VA colleagues, distinguished guests, ladies and gentlemen. Thank you all for what the Legion does day in and day out for America's veterans. At the core, the Legion's mission is about upholding America's highest ideals and providing unwavering support to your fellow veterans. The Legion's good works, day in and day out, have been crucial to the lives of millions of our fellow citizens all across this country. So, from the Secretary of Veterans Affairs, thank you all. It's been about 4 years now. I've had the privilege of giving back to those veterans of World War II and Korea who raised me as a young pup in the profession of arms. The opportunity to give back also to veterans I went to war with in Vietnam, and the opportunity to give back to those I sent to war as a service chief. Now, as I've said before, very little of what we do in VA originates in VA. Much and most of what we work on originates in DoD, the Department of Defense. The past 4 years were spent working closely with 2 very dedicated public servants, Secretaries of Defense Bob Gates and Leon Panetta. Our work to create a seamless transition between our 2 large departments for the benefit of service members and veterans. The men and women who have served are the continuity between our 2 departments. The lack of seamlessness, this is what we've been working on, the lack of seamlessness today is most visible to all of you as the backlog in compensation claims. If it takes 265 days to process a disability claim, 200 of those days are usually spent awaiting information from the IRS, from DoD, Social Security Administration, from the veteran himself or herself, or some other repository of data to fully develop that claim so we can process it. And VA is not without its own warts here. The remaining 65 processing days could be more efficient. And so I'll talk a little bit more about that later. But both secretaries are working on this transition. Our collaboration has forced our departments to agree on solutions that break these logjams. This relationship between the secretaries will be important in assuring that our departments keep our promises. Now, some of you may have been following the confirmation of Senator Chuck Hagel, the President's nominee to replace Secretary of Defense Leon Panetta. From my Army days, Chuck Hagel's a straight shooter, principled, decisive, deeply committed to those who go into harm's way for our nation. Chuck Hagel's also a soldier, Staff Sergeant of Infantry, twice wounded in Vietnam, successful businessman, entrepreneur, innovator, Republican senator from Nebraska, reelected with 83% of the vote, the largest margin in any race in state history. He was also appointed by President Reagan to serve as Deputy Administrator of the Veterans Administration, the forerunner of today's VA. He was primarily responsible for leading VA into creating VISTA, as some of you may know, our current electronic health record. 15 years ahead of his time. Bold, creative, visionary. Some of you may also know that he resigned that position in protest over proposed cuts to veterans' benefits. Simple question. What more do we in VA want, in a partner at DOD? Our nation's at war. Up to 1 million veterans are expected to leave the military over the next 5 years. They need a smart, tough, business-savvy, compassionate SecDef to help them bridge those transitions. Someone with the right instincts about national security, and someone who cares deeply about those who walk point for the nation. They don't come any better than Chuck Hagel, and I hope you all feel the same way. 4 years ago, President Obama asked me to do two things: make things better for veterans quickly, that's in the near term, and then put into place those changes that will continue to make things better for veterans well into the 21st century. Now look, change is hard, and change in large organizations is near impossible. At least that's what I'm told. 324,000 good people come to work at VA facilities every day, but we are changing. Change is hard work. It requires discipline, determination, and money. And so that's what we've been after, creating change that makes a difference for veterans. During the past 4 years of slow economic recovery, the President has not wavered in his support of veterans. Despite fiscal challenges, he increased VA's budget, our budget requests, from $99.8 billion in 2009 to $140 billion this year, 2013, roughly a 40% increase at a time of enormous budgetary pressures. What have we done with those historic increases? Well, between 2009 and 2014, our medical budget increased traumatic brain injury funding by 21%, spinal cord injury programs by 36%, mental health by 45%, readjustment counseling, you may know as vet centers, readjustment counseling, 49%, long-term care, 50%, prosthetics, 75%, women's veterans programs by 158%, and OEF, OIF, OND funding by 161%. Now, funding these programs is one thing. Making them accessible to veterans is equally important. So in the same period, we opened 38 community-based outpatient clinics for a total of 821 CBOCs today, and increased the numbers of mobile outpatient clinics and mobile vet centers serving rural veterans to 70. Last August, we opened a new state-of-the-art medical center in Las Vegas, our first hospital in 17 years. We expect to open another new state-of-the-art medical facility in Orlando this year. We've been challenged here, but we're moving forward with the contractor. New hospitals are also under construction in Denver and New Orleans, and 2 others, Louisville and Omaha, are in design at the moment. To make things better for veterans quickly, as the President instructed, VA established 3 key priorities 4 years ago, and you've heard me talk about them for the past 4 years. Increase access for veterans to VA care and benefits. Eliminate this thing called the claims backlog in 2015, and then end veterans homelessness also in 2015. So let me touch on access. Since 2009, we've added over 800,000 veterans to our healthcare rolls. But access is more than just the ability to walk into a VA medical facility. Telehealth and telemedicine are major breakthroughs in healthcare delivery and 21st century medicine. This year, VA is investing roughly $335 million in virtual access technologies to connect veterans to the larger VA healthcare system from wherever they are able to enter that system. This is a 368% increase in funding since 2009 to link our 152 medical centers and their 104 affiliated medical schools, best medical schools across the country, to our 821 community-based outpatient clinics and our 300 vet centers with our mobile clinics, over 1,300 VA points of care. We've also opened 6 new cemeteries and 2 annexes in the last 4 years. 5 more cemeteries are planned over the next 5 years. We will provide burial services where no VA, state, or tribal cemeteries currently offer veterans plots. Innovative partnership with existing public and private cemeteries will allow our rural initiative to open 8 national veterans burial grounds that meet the standards of our existing 131 national shrines. Again, access. So now let me be direct. Access is also about processing veterans' compensation claims better and faster than we do today. We intend to process claims in less than 125 days at 98% accuracy and to end this thing called the backlog that has built up over decades. Well, we're not there yet, as all of us know. Even though we're processing 1 million claims each year, 4.1 million claims processed over the last 4 years, unprecedented numbers. Even as we process those 4.1 million claims going out the door, another 4.6 million claims flowed back in. Paper claims. So we must automate, get out of paper, and we are in the process of doing that. Today we're deploying an automated tool that we developed over the past 2 years. It's taken 2 years to put this tool together. VBMS, the Veterans Benefits Management System. Starting last October, VBMS has been deployed to 20 VBA regional offices today and will be in all 56 regional offices by the end of this year. The American Legion and other VSOs got a chance to see VBMS in operation at Atlanta Regional Office this past week. I'm told that all we're impressed with is functionality. So my message to you is VBMS is here, it works, we are on track to eliminating this backlog in 2015. Now the last of our 3 promises, access, backlog, homelessness, the last of our 3 promises was to end veterans homelessness also in 2015. We have reduced the estimated number of homeless veterans living on our streets by 17% since 2009. Today's estimate is 62,600. Again, it's an estimate. In addition to this rescue effort, we're also creating a national homeless veterans registry to track our known homeless and at-risk populations closely to ensure that resources end up where they're needed. Winning this battle against veterans homelessness entails both rescue and prevention. Rescue those who are on the streets today and prevent those at risk of homelessness from starting into that downward spiral. Calls to our National Call Center for Homeless Veterans were up 123% last year. Referrals into our VA services are up 132%. All good signs. Our prevention strategy includes close partnership with about 150 community nonprofits all across the country. In 2011, we awarded $60 million in supportive service grants to those nonprofits to assist veterans and families avoid life on the streets. In 2012, we increased those grants to $100 million, and for 2013, we are currently reviewing proposals for the $300 million in grants we will distribute later this year. These resources directly helped about 21,000 veterans and over 35,000 household members, including 9,000 children, This year's grants will help up to 70,000 veterans and family members avoid homelessness. Now, there's nothing magical about preventing homelessness. It requires a good transition assistance program for everyone departing DOD before the uniform comes off. It requires education and training programs that equip veterans with necessary skills. It requires a high-quality health care to deal with the baggage that comes with life in uniform, and jobs with futures. Again, nothing exotic here, just the essentials, and we're after this. Since 2009, over $25 billion in post-9/11 GI Bill benefits have covered the education and training of more than 893,000 service members, veterans, family members, and survivors who are in the program. We're now working with SVA, Student Veterans of America, to track graduation rates. I still deliver a one-word speech to any student veteran audience I speak to. And that one-word speech is graduate. That's it, graduate. There's no payoff to you, no payoff to the program, no payoff to the country if you don't graduate. So graduate. And if I sound like your dad, I am. I'm paying most of your bills. And if you work it right, you may get a car on graduation day. The American Legion can be helpful to us here because all across the country where these youngsters are in school, the reinforcement of your local chapters about the importance of graduation, and they're taking advantage of this opportunity that they have and most generations of veterans have not had. The country needs them to do well, and so encouragement to them would be helpful. Now, for some veterans, education alone may not be enough. For these, we need to help them deal with the baggage they're carrying when they come to us: depression, substance abuse, PTSD, TBI, other mental health issues. The number of veterans seeking VA mental health care has increased, and we are increasing staffing levels, growing our tele-mental health capabilities, and employing state-of-the-art evidence-based therapies. We will meet the President's 30 June deadline to increase our mental health staff by 1,600. We're also hiring and training 800 peer-to-peer mental health specialists, veterans who have wrestled with mental health issues themselves and succeeded. Credibility and trust are important in counseling, and these peer counselors have it. We've integrated mental health care into the primary care clinics of our medical centers and many of our larger community-based outpatient clinics to do two things: to expand access, again, and then to reduce the stigma associated with mental health care. In the aftermath of battle, VA has grown a large and good mental health system, crucial to helping veterans make it all the way home. It'll be no different this time. If we diagnose and treat, people get better. We must get those in need of treatment into our programs, and we look for help from the VSOs in this. Suicides. Since its inception in 2007, the Veterans Crisis Line in Canandaigua, New York, has answered over 725,000 calls, responded to more than 80,000 chats, and 5,000 texts from veterans in need. In the most serious calls, 25,000 men and women have been rescued from a suicide in progress because of our intervention, the equivalent of 2 Army divisions. The number of calls is increasing, the percentage of rescues is going down, the number of veterans going into treatment is going up, and the veteran suicide rate has declined slightly. So all good signs. Again, the number of calls are going up, which means people are calling. The rate of intervention is going down, which means people are calling early. And the level of referrals into treatment is going up, which means people actually end up in treatment, and the suicide rate is declining. So all good indicators. We just got to hold the program together. We have just completed a 2012 VA suicide data report, and it bears close reading. The average veteran suicide profile is a 50-year-old, not a 30-year-old. We are working hard to understand this issue. VA and DoD have jointly funded a $100 million suicide research project. On the one hand, I'm pleased with that. But on the other, as I tell my folks, we'll be better informed about suicides, but we're not going to wait 10 years for the study's final results. More to come as we push on this issue in future reports. So VA's efforts to change is a work in progress. We've covered a lot of ground over the last 4 years, but more remains to be done. Key to this transformation, I see again, is the close working relationship I described earlier between the Secretaries of Defense and VA. I have met 12 times with Secretaries Gates and Panetta in the last 2 years, 3 times since December the 6th, 2012 alone. Unprecedented between 2 cabinet secretaries. Senator Hagel understands the importance of this relationship. We will work to continue harmonizing our departments for the men and women who serve and have served our nation in uniform. Now, the President delivered his State of the Union address on 12 February. I heard our President talk about the need for a middle class in this country and about the importance of education, of rebuilding that middle class and making it competitive. Each citizen should have the chance to work hard and to share in the American dream. I heard him address the mandate to increase job opportunities for all Americans, and you just heard from someone from the Department of Labor. I heard him address the importance of being able to own your own home and the need to be able to finance such an investment through responsible mortgage arrangements. I think most of you know we have a mortgage program, VA, for about 1.4 million mortgage holders. Last year, something around 80,000 of those mortgage holders defaulted on their home loans. VA got involved with financial folks, and we were able to keep 70,000 of those 80,000 folks in their homes, lowering the payments, stretching payments out. And so while we feel good about that, my challenge to ourselves is what happened on the other 10,000 or so? How do we prevent that from happening next year? We all have a hand in helping these folks prevent being homeless. Well, with the President's leadership, especially 4 years of budget increases for VA, these are the very goals we have been working towards for veterans. So if you think about the State of the Union address and the description of trying to create a middle class, this is exactly what we've been working on with veterans. Now, just remember, the World War II generation saved the world, returned home, used the original GI Bill to gain an education, bought homes, started businesses, became entrepreneurs, business leaders, doctors, scientists, and politicians, earning for us all 60 years of sustained global leadership, prosperity, and security. The current generation of veterans is fully capable of doing the same thing, of helping to grow our middle class and providing a return on the country's investments in them. The President believes in veterans and their families, believes in providing them the care and benefits they've earned, demonstrated through his budgets, knows that military service members and their families add strength to our nation's middle class, and for those seeking citizenship, deserve to earn that opportunity by serving in uniform to protect the nation. And for those reasons, the President and the Congress agreed to exempt VA from sequestration. Veterans stand ready to help rebuild the middle class and return every dollar invested in them by strengthening America. They've done it before, they will do it again. And we at VA will deliver the President's vision of a 21st century VA, worthy of those who by their service and sacrifice have kept our nation free. That's my commitment to you. God bless those who serve and have served the nation in uniform. May God continue to bless this wonderful country of ours. And thank you. It's been great being here with you this morning.